Hello, my name is Marisol Craig. Today I'll present an intervention plan to address service gaps affecting dreamers in San Diego, California. This presentation will examine barriers faced by this community and propose a program designed to improve access to services such as education, mental health, health insurance, and financial literacy to provide financial empowerment. The title of this is Dreamers in San Diego Intervention Planning. Dreamers are undocumented immigrant individuals usually brought to the United States as children. Many reside in San Diego and encounter obstacles when seeking essential services. Aside from legal and educational challenges, they frequently face financial difficulties and immigration restrictions, often result in underpayment or in employments that offer low wages. And this often does happen if the employer knows of the status of the individual of the dreamer. And this increases and leads to economic insecurity and fears of deportation. These gaps in service highlight the need for programs that provide legal aid, mental health services, education, and financial literacy. On this PowerPoint, you can see how this is the community problem and the service gaps that there is quite a few on here that affect dreamers, from language barriers to there's no pathway to citizenship, or many dreamers don't know how to obtain information on how to apply for citizenship. So this is why legal aid and access to that is very important. Intervention plan, Dreamers Resource and Support Network. The proposed intervention, the Dreamers Resource Support Network, aims to connect dreamers with essential resources through a centralized platform. This would be a digital resource hub. Alongside legal, immigration, and mental health services, it will also offer financial education, financial literacy, career development workshops, and knowledge in wage gaps. So this could be through workshops and courses that can tackle the wage disparities and the economic hurdles faced by dreamers in this country. And here is a breakdown of some of the intervention plans that would consist of what the Dreamers Resource and Support Network would be, the Resource Hub. Goals for dreamers: improve access to services for dreamers by using ethical technology tools such as a resource hub that connects them with legal, educational, mental health, and financial resources. This could be workshops and courses, a one-stop shop for all resource-related needs. 2, use secure technology systems to track services outcomes and gather program data and communicate with community partners while protecting confidentiality. The first goal aims to enhance access to resources through technology, and that would be the Resource Hub. The second goal emphasizes the use of secure systems to monitor program progress, uphold ethical data practices, and to foster community collaboration and also partnerships with organizations. So that would mean while we use these technology and this resource hub that offers so much resources, so much opportunities for dreamers to learn ways that they can seek their needs to be met, they will still be resting assured that we would be working diligently to ensure that their information is private, especially because many dreamers do fear deportation and do fear a lot of their information being public to Homeland Security or ICE, and this would be protected and it would not be available and it would not be provided to those agencies. Objectives. Technology tools such as a digital resource hub and case management systems that track client services and their needs. This will also be a way for social workers to facilitate collaboration with stakeholders and other potential partnerships. And ethical use of technology such as obtaining release of information, consent to treat, protect clients' personal data, and maintain client confidentiality. That goes right back to, as I stated, that we would make sure that we follow protocol. We ensure that our clients' safety and privacy is our priority and maintain that confidentiality. Monitoring client data and progress by regularly having meetings with team members assigned to client cases to remain up to date on clients' needs and ensure that client is on track. Additionally, ensuring that staff are up to date with proper training and courses that help remain ethical and responsible. Though this is a digital resource hub, we would be working very closely with our clients, helping them navigate the digital resource hub, as many may not know how to. It can be challenging. Of course, we would try to make it as easy and simple as possible. However, we would still be very much involved and very much accessible to support our clients. The technology tools such as the digital resource hub and case management systems help track client services, and this would be the objective, while also ensuring that our clients are protected. Target population. Dreamers living in San Diego, California. Undocumented students, workers, and individuals seeking career opportunities. Dreamers who do not have DACA and other protections. Undocumented individuals who do not have access to legal services or legal support, legal aid. Undocumented individuals who do not have health care or access to other resources, that being mental health services as well. The Dreamer population faces many challenges that directly and severely affect their lives. This program aims to support Dreamers in San Diego County who encounter these obstacles, such as in employment and education and mental health, in financial literacy, and other support services. It would assist individuals regardless whether or not they have that DACA status and that DACA protection. It will be used to help Dreamers managing social and economic challenges. Program activities and financial education topics. These are the key components for my intervention. Some of the key components of this program include promoting accessible resources such as financial, educational, and mental health support services that will be all centralized in the digital resource hub. Many Dreamers face wage disparities and limited opportunities for career growth, and that also includes limited opportunities for college education. There will be workshops on financial literacy that will teach Dreamers how to learn how to budget better, learn career advancements, and how to negotiate fair wages to improve their economic stability. Since mental health services are often out of reach as well, these initiatives will also offer support and education opportunities in this area, supporting Dreamers on how to access basic and essential needs such as healthcare, insurance, and mental health services, and really just be able to advocate for themselves and live comfortably with all their needs being met. Resources needed, collaboration, partnerships. That is the key to be able to properly and successfully implement any policy, any program to create resources. So implementing this program requires various resources, including staff, funding, and other necessary materials and tools to accomplish these goals. So that being social workers, will help connect all of this, connect clients to the digital resource hub, and to connect social workers program and present it to partners and organizations and stakeholders, which can really make that start, the beginning of the program, achievable, and essentially will support clients in being able to access these necessary resources. So with that being said, staff would include social workers, program managers, supervisors, financial literacy educators, school, college educators, legislators, stakeholders, policymakers, federal, local, school directors, and funding would come from grants, scholarships, lotteries, donations. County contracts is a big one, and nonprofit partnerships. Materials would be that digital hub, educational resources, and financial literacy curriculum. All of this will tie right into, they will be all centralized into the hub. Supervision. Supervision is very important, very vital. As an MSW intern who today is my last day on site, I would not be as successful as I was in my internship without the guidance and support of my peers and my supervisor. Therefore, this falls into place for anything that we are trying to do to work with communities. So weekly supervisions with program managers, consultation with educators and other partnerships, mandatory training so that those CEUs, and regular knowledge checks and updates with your supervisor or with colleagues. Review your notes, your assessments, any paperwork, any documentation, especially if it's county-based. Make sure that that is all up to date, and all within the regulations, and also request that feedback in areas of improvement and areas that we're doing great and that we should continue. So yes, supervision guarantees that we all are adhering to the professional and ethical standards of social work and the work that we do with communities, and when assisting dreamers. So ensuring that we are communicating effectively is very important in this process, in any process that you are working with communities. Timeline. My apologies, it looks like my camera is a little bit in the way. I will explain what's there. So timeline. The program will start with planning and establishing partnerships, and that would take about 1 to 3 months. And then it will go to collaboration and setting up. That I would expect to be about 3 to 5 months. And that would consist of staff training, and setting up any necessary technology, so that resource hub, getting all of those technological kinks out of the way. That way we would be up and running. And then program implementation. So that would be about 5 to 8 months post all of the digital things being set up. After the program implementation and the launching, it would be we would need to continue monitoring. So monitoring, evaluation, improvements where needed, and modifications to ensure that all services are aligning with the community needs, and that would be about 8 to 18 months, so 8 to about a year and a half post the setting up of the program. So checking in, monitoring regularly, and then following up with maybe a staff meeting and ensuring that everything is running effectively and that we can see that the program is working, and we can see the participation of clients. Outcomes. Expected outcomes and how they will be measured. Here is a breakdown of what would be expected outcomes and how they will be measured. Expected outcomes is increased access to legal mental health services, healthcare, insurance, so providing those links, those resources to how to have access to applying, and educational services and financial literacy, among other resources that could be provided to Dreamers. And it will be measured through program participation data, surveys, client satisfaction surveys, and employment outcome trackings. Expected outcomes include increased access to services, so improved financial literacy and better employment opportunities for Dreamers with fair wages, and access to mental health services. These outcomes would be measured through, again, program data, surveys, and evaluation reports. A summary. The plan will be a community-driven initiative to support Dreamers in San Diego, California, San Diego County, through a combination of technology, which would be the digital resource hub, and direct assistance, which would be us making sure that we have contact information, that they can contact us directly, message us electronically, whether that be email or through the digital hub itself. If we have a physical office, that they would be able to have the address to and stop by and visit with us, or maybe we can do home visits if that is something that would be appropriate. And strong community partnerships, so partnering with local nonprofits, partnering with county schools, community centers, just anybody that we can partner with to ensure that we have that community partnership, that strong community foundation. It will feature a digital resource hub where clients can find information on legal services and education, mental health, and financial literacy, all in one single accessible platform. So they don't have to they don't have to go looking at other places to find resources, to find links. We will have it all a one-stop shop. The program will conduct regular workshops covering legal rights, educational access, financial literacy, and career growth. These sessions are designed to tackle issues such as wage disparity and limited job opportunities. The intervention will also involve case management, with social workers collaborating directly with clients to assess their needs and provide referrals and monitor progress through secure digital systems. This includes mental health services and the accessibility to mental health services. Partnerships with local San Diego organizations will help broaden outreach and connect clients to trusted community services such as Vista Hill, which is where I did my internship at, where we provide mental and behavioral health services, and among so many other resources and services that we provide. Finally, continuous monitoring and evaluation and assessments will be implemented to evaluate outcomes and refine any services, and ensure that ethical and effective use of technology is being used, and that we prioritize our clients' confidentiality. A final note, supporting Dreamers is not only a matter of social justice, but also an investment in community well-being. By providing legal support, mental health resources, and financial education, career, and college opportunities, social workers can help Dreamers overcome systemic barriers and build more stable and empowered futures. Dreamers truly make America great, and we are a united nation, and as social workers, it is our responsibility to stand up against injustices and to advocate for inclusion. And this is just one way that we can make a huge social change and break down some barriers. Thank you for watching my presentation. Here are just a couple of the resources that I was able to use to help support my presentation. Thank you so much for watching.